Hi, my name is Willie Phillips. This is Ken 760. Today I'm going over a static postural assessment of a 23-year-old soccer player. With my assessment, I'm going to check the kinetic chain checkpoints and go over common distortion syndromes. With these checkpoints, you want to look at the foot and ankle, the knees, the lumbopelvic hip complex, the shoulders, the head, and cervical spine. Anteriorly, when looking at the feet and ankles, you want to make sure that the feet and ankles are straight and parallel, not flattened or externally rotated. You want to look at the knees, making sure the knees are in line with the feet. You want to look at the hips, making sure that the hips are level. Looking at the shoulders, making sure that the shoulders are level, not elevated or rounded. You want to look at the head, making sure that the head is in neutral position, not tilted or rotated. Laterally, we want to look at the foot and ankle, making sure that the lower leg and the foot makes a 90-degree angle. You want to look at the knees, making sure that the knees are not flexed or hyperextended. We want to look at the hips, making sure that the hips are not anteriorly or posteriorly rotated. We want to look at the shoulders, making sure that the shoulders have their normal kyphotic curvature and not excessively rounded. We want to look at the head and make sure the head is not forward and that it's in a neutral position. Posteriorly, we're going to look at the feet and the ankles, making sure that the feet are not everted or have excessive rotation. We want to look at the knees, making sure the knees are neutral, not abducted or adducted. We want to look at the hips, making sure the hips are level. There are no asymmetries. We want to look at the scapula, making sure that the scapula is neutral. The borders of the scapula are parallel. We want to look at the shoulders, making sure that the shoulders are level, and looking at the head, making sure that the head is in a neutral position, not tilted and rotated. With there's common distortional syndromes. One is the pronation distortion syndrome. It's classified of having foot pronation and flexion, internal rotation, and adduction at the knees. Usually with this syndrome, the tight or overactive muscles are the gastrocnemius, the soleus, the peroneals, adductors, the IT band, hip flexor complex, and the biceps femoris long head are all tight and overactive. Muscles that are lengthened and underactive are the anterior and posterior tibialis, vastus medialis, the gluteus medius and maximus, hip external rotators. Another syndrome is the lower cross syndrome. With the lower cross syndrome, it's classified of having an increased lumbar curvature, lordosis, and anteriorly rotated pelvic tilt. Usually with this, the shortened overactive muscles are the gastrocnemius, the soleus, the hip flexors, the adductors, the latissimus dorsi, the erector spinae. And the lengthened and underactive muscles are usually the anterior and posterior tibialis, the gluteus medius, gluteus maximus, transverse abdominis, and the internal obliques. Also, there's upper cross syndrome. With the upper cross syndrome, is classified as having rounded shoulders and a forward head position. Usually the shortened and overactive muscles are the upper trapezius, levator scapulae, sternocleidomastoid, the scalenes, latissimus dorsi, teres major, subscapularis, pectoralis major, and pectoralis minor. Lengthened and underactive muscles are the deep cervical flexors, serratus anterior, the rhomboids, the middle and lower trapezius, and the infraspinatus. Looking at my athlete, I noticed that her feet did pronate, and she also presented with the left shoulder was solidly depressed. Her hips are pretty much level in this position. Looking laterally, I noticed that her hips are slightly anteriorly rotated, but within normal limits, and she has a slight rounded shoulders, and her head is slightly forward. Posteriorly, I can see that her feet were inverted, slightly everted, and her left shoulder is still slightly depressed. Things I want to do with her are strengthen the muscles that are weak and lengthened, and stretch the muscles that are tight and overactive. Some of the muscles I would want to strengthen with her are her anterior and posterior tibialis, her gluteus medius and hip external rotators, her serratus anterior, her rhomboids, her middle and lower trapezius. Muscles that I would want to stretch with her are her gastroc, the gastrocnemius, her soleus, her adductors, her TFL, IT band. I also want to stretch her latissimus dorsi and her pectoralis major and minor. Thank you.